Lecture 4, The Practice of Cardiac Sonography 2 unit, is entitled Image Interpretation and Descriptive Report Writing. The contents of the lecture are 1. Initial report elements, 2. Reporting LV size and function, 3. Reporting valve disease, and fourthly, report summary. The learning outcomes. Following the lecture, you'll be able to identify essential aspects of a quality written report, organize echocardiographic measurements logically, and thirdly, compose a written echocardiogram report. Chapter 23 of Essential Echocardiography is the required reading for this lecture. An important aspect of a sonographer's role is being able to communicate the findings from an exam in both verbal and written forms. That is, the sonographer's role extends beyond simply acquiring and measuring images. It includes providing a description of the images and measurements in connection with the indication for the exam. Often, this occurs in the form of a written report, essential elements of which I'll discuss in this lecture. Firstly, you can access the reporting guideline for the course from Views. The first parts of the guideline include patient details and a quality statement, which is where we'll begin. Every report should include certain patient details. This seems obvious. What I want to highlight is that the correct details are very important, especially the patient's name and date of birth. Of equal importance are entry of correct patient details into the ultrasound machine. In order to provide an appropriate and patient-specific report, each report should also include the indication for the exam. As the report is completed once all images and measurements are made, some brief details about image quality can be given. For example, if the image quality is suboptimal because the patient is intubated or supine, or because of a sternal dressing post-coronary artery bypass grafting, for example, this should be included. In this initial reporting lecture, I'll primarily discuss reporting left-sided structures and function. A more comprehensive reporting lecture will be given next year. LV size. The chamber size and wall thickness are two important measurements and should be part of all routine exam reports. Measurements should be provided in context. That is, normal values for women and men differ. As such, the report should indicate whether measurements are within the expected range, depending on the patient's sex. Moreover, these can be indexed according to the body surface area for even greater accuracy. LV systolic function. Fractional shortening, which varies slightly for men and women, and LV S prime velocity values provide information about LV systolic function, and the normal values are displayed on this slide. An LVEF is the measurement that the guidelines indicate should be part of all routine echocardiographic studies. As you know, to ensure the most accurate ejection fraction measurement by 2D, you should aim to optimize your 2D image, reduce the depth displayed to ensure a more accurate tracing, avoid image foreshortening, trace the compacted myocardium, excluding the papillary muscles, and ensure that the line at the level of the mitral annulus is close to horizontal. The 2D LV ejection fraction reference ranges, which vary slightly according to the patient's sex, are displayed here on this slide. When describing LV systolic function in the report, it's best to avoid terms like good or not good. Using terms such as normal or abnormal are much more helpful. What's also helpful is to make comparisons to previous studies. For example, if the patient's EF has dropped significantly, it's best to indicate both the current and previous LVEF measurements where possible. As you know, each cardiac cycle has two active phases, systole and diastole. Information about LV diastolic function is another important part of routine echo reports. Many people who read the report will be somewhat familiar with the terms related to LV filling or diastolic function. A statement about the patient's LV filling pattern is worthwhile. Other key variables related to LV diastolic function include the normal values for annular E' velocities, which are included on this slide. It's helpful to indicate the E over E' ratio as well. It's more helpful to indicate what this ratio means. That is, remember that it is an indication of whether the patient has or does not have, based on measurements, an elevated left ventricular end diastolic pressure. There are two important points about this ratio. Firstly, the septal and lateral annular E' measurements should be averaged. And secondly, this value is not valid in patients with prosthetic valves or hypertrophic cardiomyopathy. Left atrial volume is another important value. It's part of the algorithm for determining LV diastolic function. Moreover, it can also provide important information about disease states like mitral stenosis and mitral regurgitation. Reporting valve disease. Normally, valve leaflets appear thin and mobile. The annulus and subvalvular apparatus are similar in brightness to the surrounding tissues. The valves open fully to allow blood flow through them and close tightly to stop blood flowing backwards. In contrast, abnormal leaflets may appear thick, bright, and immobile. And if this is the case, these are helpful descriptions to include in your report. The three recommended measurements for evaluating aortic valve stenosis should also be included in the report for patients where there is aortic valve disease or where the indications suggest the possibility. To date, we've studied 3 ways of measuring aortic regurgitation. As such, you should be able to provide an indication about the likely degree of AR using these 3 measurements that you are now familiar with. Mitral stenosis is not as common as aortic stenosis. Nonetheless, as necessary, you should now be able to provide an evaluation of mitral stenosis. The mean gradient and pressure half-time measurements are the most straightforward and reproducible ways of evaluating mitral stenosis that you are now familiar with. We've also studied 4 ways of measuring mitral regurgitation: vena contracta, spectral density, jet profile, and pulmonary vein flow. As such, using these 4 measurements, you should now be able to provide an indication of the degree of mitral regurgitation with regards to its severity, whether it's mild or moderate or severe. When reporting mitral regurgitation, it's helpful to include a brief word about the direction of the mitral regurgitant jet, that is, whether it's central or eccentric. The reason why this is helpful is that a central jet may appear slightly more than it truly is, that is, a central jet may be overestimated, while an eccentric jet may appear less than it is, that is, it can be underestimated. By mentioning whether it's central or eccentric in the report can help the cardiologist frame the regurgitation appropriately. You're now at a point where you can also comment on the degree of tricuspid valve regurgitation based on the spectral density and jet profile. That is, the spectral density of the regurgitant jet compared to the inflow density, and the profile of the regurgitant jet, wherein severe tricuspid regurgitation has a characteristically blunt or triangular profile. The report summary. A summary of findings will vary in length depending on the images and measurements. Normal exams will include a more brief summary than an exam with multiple abnormal findings. 2 aspects of the summary I want to highlight are an answer to the indication and words related to important positive or negative findings. Firstly, if the indication asks for an evaluation of a specific chamber or valve, be sure to include specific reference to that chamber or valve in the summary. For example, if asked to evaluate the aortic valve, include and describe, supported by measurements, the aortic valve. Secondly, include specific positive or negative findings. For example, if the images and measurements indicate a definite improvement in function, include a description supported by measurements that indicate this. Or, if in the example provided on the screen, the images and measurements indicate a definite deterioration, include a description supported by the measurements that support this. That ends this brief lecture on image interpretation and report writing, with its 4 elements related to initial reporting, and finally the report summary, and reporting LV size and function and valvular disease.